Hello and welcome to another segment of Intersections, Policy, Program, and Practice Exchange. My name is Elisa Gwilliam, and today I have the pleasure to be talking to Professor of Psychology and Director of the Center of Aging and Disability Policy at Mount St. Mary College, and co-founder of the National Organization of Adult Addiction and Recovery, Dr. Larry Force, and Executive Director of Mental Health America, Dutchess, Andrew O'Grady. And our special guest today is Dutchess County Executive Marcus Molinaro. So Andrew, would you like to introduce us to our special guest as we continue to talk about Dutchess County's response to addiction, recovery, and mental health?
Sure. So let me start, and I'll pass it over to Larry in a second, but let me start by saying that this is our, I think, sixth episode of this. And we've started off talking about our theory and our practice. We brought in some people last week who are working this program on the ground at our local MARC agencies. And we're going to continue to build on this and bring in speakers both statewide, locally, and nationally. And I have to say today, we're very lucky because we have our county executive here, Marcus Molinaro. Marcus has been a champion, in my opinion, of issues related to all sorts of disabilities, including addiction. And I'm blessed. I couldn't be more blessed, frankly, as an executive director of an agency in this county, knowing that I have the support of a county executive who really doesn't just talk the talk, but he walks the walk, and he moves money when he needs to into projects and into programs that he knows is going to help in this community. So I'm real happy to have a friend of mine, Marcus Molinaro, on with us, and we'll pose a question to him in a second. But Larry, did you want to mention anything before we get there?
No, look, you know how we feel. We talked about this offline. We are so glad that you've joined us today. And we're not just saying this because of the fact that you're here, but you are a tremendous leader in a variety of arenas in this county. And the one thing that I've always noticed as a resident of this county is that you lead with your heart and you lead by example. And the fact is that this is an issue, and the issue is addiction, recovery, wellness, but there's solutions. And part of it is what we're doing now with technology. I mean, why are we here? We're here because we pivoted and we made an appropriate response to the COVID-19 quarantine system. But that doesn't mean that we still can't be connected. And the one thing that we know about recovery is that you don't have to do it alone. And I think that's one of the things that we bring to the table, not only these video casts, but all the resources that we have. So again, as Andrew indicated, we're so glad you're here. And we'd like to start by maybe if you could just provide an introduction, because not only is this local, but this is statewide, and this is also national. So if you could talk about, who you are, how you arrived here, and your vision. So thank you.
Thank you, and I appreciate this. And I think actually what we've experienced over the last couple of months is a good example of the resilience that, in particular, our network, at least in this community of service providers, has. I mean, this concept of meeting people where they are has never been more important than it's been these last couple of months. We've had to go to where people live, quarantine, or obviously are dealing with their own challenges. So I'm in my third term as Dutchess County Executive. It's been an honor of a lifetime. Andrew knows this, and some of you may know I've been in public office every day of my adult life, dating back to when I was an 18-year-old village trustee in the village of Tivoli, a little place in Dutchess County. But I came to the county executive's office having served 6 years in the state assembly. I've seen the issue of provision of both mental wellness services and our response to addiction from the very local to what we've decided to and how we confront the issue from Albany, if you will, and of course partnering with all of you, many of you locally. What we've done in Dutchess County this last 8 years, I'd like to suggest as a model for the rest of the country. We're not perfect, and we say this quite often. We'll never be perfect, but we challenge ourselves to use new tools and take advantage of new opportunities to meet people where they are. We don't judge. We know that addiction is an illness. It is not a crime. No one chooses to wake up and be dependent on some substance. So we've really transformed the way we deliver services in the county. Again, I think, to overuse the term, we start by meeting people where they are on their path toward and in recovery. And that's meant partnering with a lot of agencies like Mental Health America and others to provide services 24 hours a day, 7 days a week. And I'm happy to talk about any of them. I just would offer that we've tried to create the broadest network to be able to connect with people in a way that helps them. We believe in saving lives and meeting people where they are and judging people simply by their humanity, nothing else. And I think what we've done in this county has been effective, but we have so much more still to do.
You used an analogy at a public forum about 1.5 years ago that it ties to what I've been saying for years. Although I really appreciated your analogy, I'm going to ask you to share it in a second. But one of the focuses that I've been talking about on this project is that we have too many silos and they don't talk to each other. And we're breaking down those silos. I said before that in a small part, in whatever I can control in my small little agency, in my small little world, by merging with the Mark agency, I've taken an OASAS alcohol and substance abuse program, and we're going to bring it into the MHA family. And now in my little world, I've combined those two silos. And it is actually pretty amazing. Here's two agencies. We knew each other very well, not as well as I expected that we knew each other, but we knew each other. We knew we existed. We knew what we did. But did the patients, the clients at the Mark agency doing their rehab and detox and their halfway house stuff, did they ever get an MHA case manager? No. Why? Because they were in a OASAS program and we're an OMH program. So it never really happened. Now we have everybody that comes through Mark gets an MHA case manager. It could have happened without this merger, but the merger helps bring it about. So, and there's so many other small little pieces to that. Mark residents are now volunteering for MHA events. There's synergy there, and it works. But you kind of talked about in your analogy about the fact that we have so many services in Dutchess County. We're rich with services, yet they don't all work together so perfectly. So I don't know if you wanted to share that, because I think it's very similar all over the country.
Yeah, well, I think it's true. Well, first, no one does silos better than government. I mean, that, they almost have perfected siloism, if that's a term. And no one in government does silos better than New York State. And that, I mean, it's just the reality and the challenge that we've all had. And so, dating back to when I began as county executive, we merged our public health with our mental health departments so that they would integrate more. And we really focus now on the whole health, the public, the broad spectrum of public health, and breaking down those silos are important. The other, though, and when you get that integration, we know that we can be more effective, certainly in simply making sure no one falls through the cracks, but making sure that every tool is used. And the analogy that you like, and I do too, because it's pretty evident, is really meant to address two things. One, the fact that we have all these tools, but the other, and I don't want it to go unnoted, is that we also have to transform bystanders into active helpers. That most people dealing, and I'm not the expert, right? You are. Most people dealing with mental wellness concerns, have expressed and sort of project their challenges. The question is, is there a family member who knows what to do? Is there a friend willing to take action? So converting and transforming bystanders into active partners in the recovery is very critical. So the analogy is simple, and I've used it many, many times. We do have all these tools, and I often say that my stepdad is a great mechanic. He's actually a fabulous mechanic, and his garage is filled with tools. Anytime you need somebody to do something to repair your car, his personal garage is ready to go. And if you go to his garage, you'll see tools thrown everywhere, and they're covered in grease, and they're all over. He knows exactly where they are, but he's got a tool for anything. And then if you come to my garage, you'll see that it is very neatly organized. All the tools are exactly in their right place. In fact, as I joke many times, some of the tools have a white line around them, so that if I happen to take them off the wall, I know exactly where they go back. They're clean, they're pristine, and I can point at them. Now, you know why they're clean and orderly. It's because I don't know how to use them. I mean, I can do some of it, but not most of it. Well, that same analogy is true when it comes in particular, I think, to what we do in this community, but it's true everywhere. We have a lot of tools, but too often they're very clean, they're very orderly, and they're very organized, and they're not always used effectively. And they're certainly not used by all the people who need to use them. And so what we engaged in Dutchess, when we merged the departments, when we launched our mobile intervention team in partnership with organizations like yours, Andrew, the Crisis Intervention Center, our Stabilization Center, our crisis intervention training, mental health first aid, trauma-informed care to first responders. We wanted to be sure that everybody who intersects with an individual who's on their path in recovery, wherever that is, knows of the tools, can use them to some degree, and that we're all engaged in active partners in helping the individual. Another we often talk about is, those who come to government in particular services when they're dealing with addiction or they're living with mental health concern, they're not coming to us at the moment of their best, right? They're generally in a moment of trauma or crisis. Certainly, you don't call up government first, so they're likely struggling. We have to be certain that their first interaction with us is the best it can be. And that's one of the areas that we still struggle with, right? We are very regimented in government. We have to be very sanitized in government sometimes. Our services need to be dirty like my dad's garage. Our tools need to be beat up like my dad's garage. And we have to accept that we are going to fail more than we succeed, only to motivate us to succeed more. And I think that that's still a challenge for all of us. But the tools that exist in this county, I would argue, are unlike any place else in the country. And it's partly because we're willing to let many people use them. We just need more, in particular, loved ones and family members. When somebody wishes to take their life, they often project it. And we need to hear that. When someone is dealing with addiction, in particular young people, they don't necessarily raise their hand and say, "Hi, I'm an addict." They act out in ways that we might judge instead of reacting responsibly to. So informing, educating, and giving the tools to the bystanders to become partners, I think, is critical.
I think you're sorry, Larry. I think that your mention of family members and needing that support around them is very important. I usually mention at least one thing in every conversation I have about the field I'm in and how it can do better. I'm open to pointing out, and sometimes it's sad because I put my life work into it, but it's far from perfect, and it needs help. And one of the areas that we fail at, honestly, if you're really going to speak honestly about the clinic system and about case management and MHA and all sorts of other places that serve adults, is that we don't make an active effort to bring in the family. On every service plan, on every treatment plan, it says, social supports, but we don't pay a lot of attention to that as much as we should. And we should be making that a focal point and trying to bring people back into their lives because they need it.
Can I say this? I don't want to jump in ahead, but the other is, though, we have to not only in the response planning ensure that family and friends and your social network is a part of it, but we have to be talking to them too. And it's not about case management. It's about saying to the partners in an individual's life, here are the tools. This is what your friend, family member is dealing with. This is how you can be helpful, and get them to move. I mean, listen, most of this dates back to the realization that we treated mental illness like some sort of foreign, stigma or possession, right? Although, in the 1600s, you were possessed instead of having a true health concern. We've got to break down that stigma. And that means going to family members and saying, he didn't choose to be an addict. He isn't choosing to overdose. You can't ostracize that individual. You've got to find out where they are in the path and be there when they need you. And I've said this many times. And again, I'm saddened by the loss of life, but I also know that at some point during the life of an individual that ultimately, sadly, may lose their life in the struggle, they reached out to somebody. I hope it wasn't me and I missed it. And we need people to think that way and to know that on the other end of a phone number or text message or an email is somebody there to help. Government is not the best tool, but we are one of the tools, and we have to be used effectively.
And I think that it's clear that, and this is the message that we want to get across. that you don't have to recover in isolation. Addiction is an isolating process, but you don't have to recover in isolation. You know, it's the individual, it's the family network, it's the community, you know, it's the role of government. I mean, it's a collaboration. You can't do it alone. You don't have to do it alone. And I think, you know, the point that both of you were discussing about the silos. Alyssa, could you bring up that picture, please? So I worked for state government for over 20 years.
My condolences.
Worked in institutions.
Yeah.
Okay. So the fact is that, yes, we know how to do silos, and we love acronyms. That's the other thing. You didn't mention that. We love acronyms in government. But I'm driving down Route 9, which is in our county, for those of you that are not familiar with Dutchess. And it's a Saturday morning, Saturday afternoon, probably about a month ago. And all of a sudden, this catches my eye. And I turn around and I go back on Route 9 and I stop and I take this picture. This is the main building of Hudson River Psychiatric Center that is coming down. And the fact is that the tagline I put on it is mental health at its best, tearing down the walls. Because we reference this in every video cast because I think it really provides a very accurate profile of what it used to be like. You know, behind each of those doors is a story, is a family. You know, we talk about, you know, with my students, we talk about, you know, Dutchess County, Orange County, very rich with institutions and prisons. Why? Because when they were built, they were isolated from urban settings. And now, thank God, we're at the point where we're tearing down the walls. And I think that with that comes down the silos. You know, not to be able to take, you know, individuals that were institutionalized and put them in a community setting, help them transition to a community setting, and then create new silos. But the idea of, you know, the support that you provided for Andrew and his agency to be able to take a look at mental health combining with addiction and recovery, that's a model. My colleague Jeff Kahan and I at our Center on Aging, a number of years ago, we ended up getting a National Institute of Health grant. And we traveled through the country looking at various systems. And again, I am not saying this because you're here, but I am saying this to you because you are here. Dutchess County is alive. There are a lot of places that are not alive with services. And the fact is that you've done a nice job in leading this conversation about how to go about addressing this. And you say it from your heart. It's not, you know, the whole idea of stigma, the whole idea of, you know, how the person was perceived years ago. When I came into the field of psychology, there were textbook definitions that would no longer be accepted. We don't use them anymore, nor would they be accepted because we've moved away from the stigma. And I think that, you know, the goal of this exchange is exactly what we're doing. Taking this concept and conversation about aging and addictions and highlighting it to a national level, talking about how is it going to be delivered now with technology, now with the COVID response. I tell my students one thing. In today's world, when you go into a family's life, you bring two things. You bring your heart and you bring technology. If you can only bring one, you bring your heart. But you can't act as though the technology doesn't exist. And I think that the benefit for applause for this is the fact that look at what we're doing, getting this message out and being able to talk about new ways to deliver. We had two guests on last week that talked about digital solution recovery. The terminology, you know, the terminology is now starting to catch up. Because why? Because yes, we're here on a Zoom video cast, but you know that this is really, you know, I had a conversation with the CEO of a medical center about 4 or 5 years ago. I said, what's the hospital of the future look like? He held up his phone. He said, it's not going to be these large, he said, because everything is going to be community-based. The formal name of our program is called Intersections, a Day Program Without Walls, because the person can take the things that we're looking to embed, new ways of entertaining yourself, engaging yourself in healthy ways. So, Andrew?
Well said.
I mean, I think that's, you know, that's the message.
Well, I would say, we've often said this as well. I mean, if my mind was working correctly, I would convince myself to get on the bus and go to Poughkeepsie to a session with the therapist, or go to Andrew's, program, or to meet with. If my mind was working correctly, I might not choose to ever take a pill I didn't necessarily want to take. But that's not what we're dealing with. So you've got to make sure the technology, the tool is where it needs to be when they need it, when an individual needs it. And to your point about the national component, I mean, we have to confront mental health as a physical health or a whole body health concern. I mean, we have the fact that insurance is, there is limited insurance coverage for mental health concerns. The federal government has diminished its commitment to mental health. And I say respectfully, and I don't want to sound at all political, the state over decades has diminished its commitment to mental health, and in fact has offloaded it in many cases. And then you have counties like mine that are struggling to pay our bills and meet our needs. And some of them have offloaded the services, simply being, agents of transferring dollars. But so I do think there needs to be sort of a revisit, and that at every level of government, we have to be breaking down those barriers. And we know this. And we're talking about COVID today, but it was only a year ago we were struggling to respond as a society to yet one more shooting, and we knew that incident was likely an individual who had experienced some trauma in his younger life. Generally, younger boys experience trauma, and perhaps that was projected at one point, and we missed it. So there just has to be this whole integration if we're going to confront a lot of issues, and pretending like they're separate: criminal justice from public health, from mental health, from our private care system, our public care system. And I don't recall what event I was at, but somebody, referenced, when you go to your doctor, you're a patient. When you go to a mental health provider through government, you're a case number. And society and government decided decades ago that public health, physical health, we treat the human. But when it comes to mental health, we're going to give you a case number and send you to some agency. And that isn't really, with all due respect, the most productive way of confronting. The other I've thought out loud, and I don't, the term recovery suggests it's a destination. Like we've concluded our service, now we're going. It's living. Every day we have to convince ourselves not to be tempted by something. So I feel like at times we say to people, well, if you're not on recovery, or you haven't made it to recovery, you failed. Now, every day is that challenge. Every day for all of us is that challenge. Some have it much more intensely than others. And I just think that we need to get past that terminology, and also how we deliver those services.
Absolutely.
Yeah, we all agree that you mentioned a shooting, and that's always a political thing. When there's a terrible mass shooting or something, it's interesting because we split down the middle politically. We split. It's not the guns don't kill people, but so we have that argument and nobody agrees. But it's interesting that everybody agrees, all the politicians, everybody agrees there needs to be stronger money and stronger focus on improving our mental health system, on putting money toward research for mental health, on putting everybody agrees across the board. And if anything good can ever come out of those terrible tragedies, I always hope that it's that, but that always seems to just go by the wayside as well. And this country has such a short memory that we all get jazzed up about something, and then 2 weeks later it goes away.
2 weeks later is a long time. I mean,
yeah,
these days it's minutes. It's a tweet away.
Yeah.
But that's, I mean, and again, and I listen, having been in government, I also know what we do a lot of is we don't ever question what we do. We just add to what we do. Well, we did it this way last year. Let's add more money and another. I mean, there really always needs to be that sort of holistic challenge to say, are we providing the service effectively? And Andrew, I'd say this to you: if you're not, you can't be the ones defending, well, keep paying me for doing something I don't do well. But we don't do that. And again, I'm not suggesting that anyone's at fault for it. It's just this, like anyone else, we have to question, how are we delivering? Are we being effective? And what's the new tool we need in the toolbox? And maybe I don't need that old one anymore. But we have to be honest about that. And I don't know that we are.
Yeah, I agree.
I like that overarching theme about the redefining of recovery. I mean, it's not a destination; it's a journey, and it's a daily journey, and it's a process of learning. In a simple way, learning new ways to engage, to entertain yourself. I mean, I think the thing that has been so well received from our Intersections program is that it's focused on wellness, it's focused on movement, on nutrition. I can guarantee. I have a small practice. I tell people when they come in, I'm not your hero. I can't fix you. And the reason I can't fix you is because you're not broken. We all have stuff. And the fact is, I also have a personal belief, some of my colleagues, they don't really necessarily like this, but for me personally, the best therapist you can find is one you forget, meaning that you've gone back to the engagement of your life. And I think that with the Intersections program, the idea is to be able to provide people with opportunities to engage in behavior that is more productive, that is safer, that is more meaningful. Because if you feel better about yourself, you'll feel better about the things around you. That's a guarantee. So I think at this point, are there any summary statements or comments?
Well, I want to say this, and I appreciate the conversation. One of the other things that we put a lot of intense focus on, in particular for those dealing with addiction, is Narcan training and the use of Narcan. And I always like to add this only in that there still seems to be a controversy among some that suggests, well, how many times are we going to administer? How many times are we going? Why do we have to keep going to the same people? Because it is our job to protect life.
Absolutely.
I don't ask how many times you're going to have a heart attack or how many times do I need to respond to burnt toast and a false fire alarm. We do it. That's our job. And I just would offer, among all of the things that we do, that might be that is one of the tools that can be used by anybody who's dealing or related to or interacting with somebody who may be dealing with addiction, that makes them active and hopefully empowers them in some way to recognize that they can be a lifesaver. Now that is sort of the most profound way, right? I show up and I'm administering Narcan, I'm saving someone's life, but it is a reminder that we all have to play an active role. And to that point, right, we all have our own challenges. Judging people is not the place we start. Let's start by trying to be helpful.
Absolutely. Well said. Andrew?
No, listen, I'm not going to step on that one. That was great.
Well, thank you, Larry, and thank you, Andrew. And a very special thank you to our special guest today, Dutchess County Executive Mark Molinaro. And thank you for joining us today. You've been listening to Intersections, Policy, Program, and Practice Exchange. If you want to hear this program again, share it with friends, or even comment on it, log on to our Digital Resource Center on our website, www.intersections-exchange.org. You can also follow us on Facebook, Instagram, and YouTube. We hope that you join us next week as we continue our conversation on Intersections, Policy, Program, and Practice Exchange.